right, Danielle, can you break down what we need to know about Medicare and why we hear so much about it this time of year?
Sure. So the annual election period in the fall from October 15th to December 7th is when 64 million people on Medicare can make changes to either their Part D drug plan or their Medicare Advantage plan if they have one. They can choose to enroll in, change, or disenroll from both of those plans. And so this is why we see so many Medicare commercials this time of year and why you have people asking questions about, should I be doing something? Those are the plans they need to concentrate on reviewing every year at this time.
And you mentioned, most people we think of become eligible for Medicare at age 65, but what should they do if they're still working and they have employer coverage?
Yeah, that's right. And we see more of that today than ever. So if you are still working and you work for a large employer, which has 20 or more employees, your group coverage is actually primary, and you can delay your enrollment into Medicare without penalty and enroll in those later on when you finally leave your active job. However, if you work for a small employer with less than 20 employees, then Medicare is primary. So it's super important that you would sign up for both parts A and B during your initial enrollment period, which is a 7-month window surrounding your 65th birthday.
And we hear it all the time. There's so many Medicare parts and plans. So how does a new Medicare beneficiary decide what coverage is right for them?
It's true, and it's really confusing for people because all their lives they've had employers which have chosen their insurance for them. Maybe they have an option for an HMO and a PPO, but they don't have to dig into a national health insurance program with 4 parts, 10 Medigap plans, and thousands of Part D and Advantage plans options. So it can be really overwhelming. What's important if you're coming up on Medicare is to start your research early. We recommend that people begin looking into it around age 64 or 64 and a half, and also that they work with their financial advisor because your income can affect what you'll be spending for Medicare once you get on it. So those are all things that take time to prepare for.
And I understand the recent Inflation Reduction Act will result in changes to Medicare's outpatient drug coverage. What do we need to know about that?
Yes, it is the most sweeping legislation to affect Part D since it was enacted in 2006 and rolled out. And what they need to know is this is going to make Part D better for everyone. So Medicare Part D is a lot more difficult to understand than coverage they had when they were under 65, and it doesn't have any cap on it. With an under 65 plan, you've always had a deductible and an out-of-pocket maximum. With Medicare Part D, you have 4 different stages, and when you get to catastrophic coverage, you still pay 5% for your medications. And so the biggest change that's going to be coming in 2025 is that they'll be bringing that down to a hard cap, where Part D expenses will be no more than $2,000 in a calendar year. There are also some changes coming sooner to the cost of insulin, which will now be a $35 copay no matter which stage of your drug plan that you're in, and some coverage of some Part D vaccines like the shingles vaccines that have been expensive for beneficiaries up until now.
Oh, some big changes coming our way. Tayvon, how does having tax-free income affect Medicare?
Well, I will say this first. Medicare is as complicated as calculus, so it's very confusing. But the problem is most people have their life savings in either like a 401k or a TSP that has not been taxed yet. So what happens is when you start taking that income, it not only makes your Social Security taxable, but it also makes your Medicare Part B premiums more expensive as well. So it's very important to work with an advisor that can put together a tax-free plan for you as well.
Such great information.